Yeah, I am Professor Oliviero Bruni, full professor of Child Neuropsychiatry at the Sapienza University of Rome. I was involved in child neuropsychiatry and especially in the sleep medicine field for over 30 years. My journey started a long time ago, and I was a young student, and I was always passionate about mental health and child neurology and child psychiatry in particular. So my journey started with the residency in child neuropsychiatry, and I started as a child neurologist. Then I switched on also on psychiatry, and in 1990 I became involved in sleep research, and I go through all these years studying sleep and the correlation between sleep and neurodevelopmental disorders since then. For young students and for young physicians, I think that one of the most passionate field is the mental health in infants and adolescents. That's because in this field you can in some way modify the future health of the child and of the family. So I think as a child neurologist or child psychiatry, you are in the best position in order to improve the mental health and shape a better future for a child and for his family. My field of research was sleep in infants and children. Actually, I study sleep from a neurophysiological point of view in order to understand the mechanism by which sleep might influence the mental health and the growth of the children. And studying sleep is a sort of window over the mental health of the child. So studying sleep may, you know that sleep is extremely important for the growth and for shaping the connection on the brain, because sleep is following the growth of the brain. The growth of the brain is strictly linked to sleep, because during sleep the brain is forming connection, and the process of synaptogenesis and the process of synaptic pruning that are extremely relevant for brain growth happen mainly during sleep. So if you try to understand what happens in sleep, this means that you try to understand what happens in the brain of the infant and of the child. My topic at this Congress is related to pediatric restless leg syndrome. This syndrome is not so very well known in the pediatric field, but is extremely important to understand because it's strictly related to several comorbidities. The main comorbidity would be insomnia. Children with pediatric restless leg syndrome appear to be infants with several night awakenings, and that moves a lot during the night. And not only this, but other comorbidities are, in example, ADHD. And this is an extremely important point, because if you act very early and treating pediatric restless leg syndrome, probably you could prevent the development of ADHD and other behavioral disorders. I think that collaboration across pediatrics is essential for the development of the future pediatrics, because we don't know everything. So collaborating with the other specialty, like I'm a child neurologist, child psychiatrist, and general pediatrician is extremely important, because we could in some way prevent the development of several disorders. So we can combine different fields like neonatology, neurology, sleep medicine, respiratory medicine, psychiatry, genetics, and together with the primary care pediatrician. So collaboration with the enable, in example, earlier diagnosis. In example that some pediatrician may have a questionnaire that could in some way define the autism spectrum disorder. So the more earlier we made the diagnosis, the better is for the outcome of these children. And probably this interdisciplinary collaboration, creating platform might be the future, because also we are going toward personalized medicine. And this is extremely important, because together with the collaboration across pediatric field, we could have a better view of what is personalized medicine. Well, I'm excited because I think that coming into these very big congresses with different field of pediatrics, then you can have a general overview of what is happening in the research in the different fields. So having this overview could improve your knowledge and also inspire new research. That is the most important point, I think, when you go to the Congress. Going to the Congress is to pick up what is happening and what will be happening in the future of the research in pediatrics. So that is the most excited part for me coming to the EAPS. My message to the pediatric community is to increase the collaboration and not being in your specific field, because expanding knowledge and collaborating with different pediatricians in different fields could always improve our knowledge, and mostly important, could improve the health of our child, and not only the child but also the families, and also the general politics and all the decision about pediatric health in this field.